Good morning, everyone, and I apologize that I wasn't able to join last week. Just a quick update on some of the stats. As we know, as of last night, Connecticut had 31,000 positive cases and 2,700 deaths. In the Farmington Valley, we have 448 positive cases, lab-confirmed cases, and we've had 70 deaths. The majority of these deaths are occurring in our older populations, and the majority are living in our long-term care facilities. So sadly, our long-term care facilities are really, significantly impacted by this virus. We have tested about 1.3% of Farmington Valley residents have actually been tested, which is significantly below the state average of 3%. And we have not seen statewide any real substantial increase in testing capability yet. On average, at the state level, we're seeing testing of 2,000 to 4,000 people a week. The goal to really get us to a better place is upwards of 50,000 tests a week by the end of May at the state level. There are still significant shortages of different aspects of the test, whether that be the transport media, the swabs. But this increase in testing is really central to our ability to move forward in, beginning to open up, businesses, et cetera, and our ability to do contact tracing and kind of squash outbreaks as we begin to open up. So we're tracking this closely, but a lot of work needs to happen for us to get to that 50,000 a week testing level established by the state. Shifting gears a little bit, there is some good news, I think, on the PPE front. All long-term care facilities will be, according to the state, getting a direct shipment of a 14-day supply of the PPE that they require. So this is good. As we know, our long-term care facilities have been getting increasingly more PPE, but I know, our emergency managers across the valley and Farmington Valley have been trying to backfill some of their needs because they haven't had everything that they've needed. The Farmington Valley Health District continues to get a small allotment of PPE each week. We received about half a pallet yesterday. That half a pallet is supposed to be used to support our acute care community-based partners. As you can imagine, a half a pallet doesn't go very far in the Farmington Valley, but we're doing the best we can to prioritize, and get PPE to the people that are, doing emergency dental procedures, caring for people at home with COVID, et cetera. We are obviously tracking directives from the governor regarding the potential reopening of some businesses after May 20th. At this time, many details are lacking, and this has been incredibly challenging for many of our regulated communities. FEHD is developing our own guidelines, but as you can imagine, we can't get too far out in front of, the state, and we certainly don't want conflicting guidelines. So we are certainly hoping that the communication from the state level down to the local level regarding the expectations of what can be opened and under what circumstance increases over the next week or so. I think those are some of the highlights or lowlights, depending on how you want to look at it. And I'm available for the whole call if people have questions.
Jennifer, thank you. Before we get to others, just one question. There's starting to be news reports of an increase in New York with children-related illnesses. Are we seeing any of that in Connecticut, or is there anything that we're doing to be proactive on that?
Actually, I was just paying attention to that report this morning. We've not gotten any reports directly. We have a 2 calls a week with the state health department, and I am sure it will be a topic of discussion tomorrow. And there will probably be some inquiries as to whether a case definition that allows us to actually track and monitor that in Connecticut will be forthcoming.
Okay, thank you.
Sean, I have a question for Jennifer.
Of course, Kevin.
Jennifer, actually, a couple things. We were at a walk-in yesterday, and there was a testing facility right outside the door, apparently, and there was nobody there, and they had testing material, but they said generally speaking, unless you're have some cause to get tested, they're not testing you. So is that the standard now? They're not testing people that have no symptoms, correct?
That's correct. The state they list the priorities for testing, and because we're still only averaging 2,000 to 4,000 tests a week in the state, they still are prioritizing people with symptoms, people where the doctor feels that they are a priority, hospitalized and our sickest patients, and those in congregate living and or long-term care. Obviously, our goal is to broaden that testing capability, particularly because we're going to need far more timely results for anyone experiencing symptoms consistent if we start opening things up. I don't know when those criteria are going to change. It's going to be contingent upon the access to these tests. One thing I will address is there is currently they are not recommending testing of asymptomatic individuals, even though we know there can be asymptomatic transmission. There needs to be a justification for why you would test an asymptomatic individual. And the reason being is, an asymptomatic person tested today doesn't necessarily mean negative tomorrow. Anyway, wide-scale asymptomatic testing is not recommended at this time.
Okay, and just another follow-up question is, over the last 2 weeks, the state has changed their number crunching, so to speak, on the daily reports that are coming out, where they eliminated the age demarcations of the fatalities. Do you know anything about that? Because we're using a lot of data to give us an idea of which area, certainly we knew that the over 70s were getting hit pretty hard, but that was eliminated. Now it's done by ethnicity. So I'm not sure, is there a place that we can locate the information based on age?
Yeah, I mean, we're still getting age data, so I don't think they eliminated it. They just added race, ethnicity. I can talk to you, but we still have that data. We report that out in our reports that are on our website, and the majority of our deaths, let me pull up my most recent, are in the older population. I can send you that.
That would be great. I just want to give it so I have an understanding if it's changing a lot for the general population, based on 40s and 50-year-olds and 30-year-olds. And I think it's going to be important down the road when things start opening to have a better idea to.
Yep, that's what we epidemiologists track, Kevin. Absolutely.
Great. Thanks.
Sean, if I have one question for Jennifer, if I could.
Absolutely.
Good morning, Jennifer. This is Michael Berry. You said that the long-term care facilities were going to be getting a direct ship 14-day supply of PPE. Is that going to be a change from the pods that have been going on in West Hartford both Tuesdays and Wednesdays?
Yeah, I don't know if it's in addition to, but I know they're going to be getting a direct shipment to their actual facility. I'll see if I can get more detail on that. But my expectation is that the weekly pod distribution would still continue.
Okay, thank you, Bud. I appreciate it.
Yep. This is just kind of like a bolus to get them back to a better place.
All right, other questions for Jennifer?
This is Karen Stewart. I just have a quick question. On the reporting of the facilities, I'm only seeing numbers out in McLean. Is Governor House and Anthology reporting to you?
They're reporting to the state. There is a little bit of a delay. So you can expect that though as cases emerge there, you'll see those as well.
Karen, this is Kevin. They did report, Governor House did report an experience.
Yeah, I saw that recently. We just haven't. I'm just surprised at how much McLean has had, and yet it's been very quiet out of Governor's House. So I was just a little concerned.
Right. Other questions for Jennifer? Jennifer, thank you for all your work.
You're welcome.
All right. Maria, good morning.
Good morning. How are you? Can you hear me okay?
We can see you and hear you. The floor is yours.
Okay, great. Thanks. I was having a little bit of technical difficulties this morning, so I'm glad everyone can hear me. Good morning. So to lead off this morning, we have 2 facilities that will be reopening. They will be reopening with modifications in place. We are currently doing a soft reopening of the transfer station that started yesterday with limited services and will continue today and tomorrow. Yesterday, it seemed as if all things went very, very well with that soft reopening. And if things continue to go well, we are hoping to be providing our full scope of services at the transfer station beginning Saturday. Again, there are modified practices that we're using there, but we're really glad to be able to provide that service again. We've also received some new guidance, and our town and Board of Education tennis courts will be reopening most likely late Friday afternoon, so sometime again tomorrow afternoon, with modified practices as well. And at this time, it will be fairly limited recreational play for members of the same household. We will have more detailed information about that that's going to be available on our website and through social media. Our town buildings do remain closed to the public at this time. Most of our administrative staff is working remotely. They are physically reporting to the office on occasion to the extent practical. We're continuing to use our various online solutions. And our parks and golf crews are still reporting to work daily, again with modified practices. And when we get to the public works and police items, I'll let Tom Roy and Chief Bolter speak to what we're doing with our public works crews and our police department staff. Regarding our public building closures, again, we don't have any firm dates for when we're going to be reopened at this time. However, we are being proactive. We are beginning to make plans for phasing in the reopening of our various facilities and services and programs. Where appropriate, we are consulting with the health district, and a number of our services are trying their best to work as a region so that we are providing a similar approach to our reopening. And examples include a number of our regional libraries, social service departments, and parks and recreation departments. At this time, our playgrounds, our skate park, and our basketball courts do remain closed to the public. However, our parks, trails, and open space parcels do remain open for walking, hiking, and cycling. Our meetings will remain closed to the public at this time until further notice. At this point in time, we're mostly utilizing video Zoom to ensure that our meetings are being aired live over SCTV. We did receive additional clarification last week, and we are not permitted to hold our budget referendum that we were tentatively scheduled to have on May 30th this year. So the Board of Finance, as the budget-making authority, is scheduled to tentatively adopt the budget on May 19th. So this is a very different process for our community than what we are ordinarily used to. Once we have an adopted budget, we will be sending out a mailer to everyone in town, both commercial and residential properties, just a high-level overview of the adopted budget that went into place. We are expecting, if the budget is adopted in its current form, that would result in a mill rate decrease for our residents and our property owners, and about a $50 decrease in taxes for the median valued home. We are now accepting applications for the property tax deferral program that the Board of Selectmen recently adopted. Those applications are available on the Revenue Collector's website. We have started to receive those, and again, just really want to encourage people to complete those if they need to participate in that program. You can fill those out and submit them back to us electronically. You can send them to us in the mail, and we also have a drop box available in front of Town Hall. And a quick update on donations. I'm going to cover social services today. We have now received over 800 sewn face mask donations from community members, and social services is then supplying them to town staff, to community members, and members of our business community. So we're really grateful to our generous sewers and crafters who have been providing those face masks. And we want to encourage the public, if you need a face mask, please don't hesitate to reach out to social services. These are free face coverings that we can provide for you and your family. We are still accepting donations of toiletries and non-perishable food items. We're also accepting donations of gift cards to grocery stores, gas stations, and laundromats. We're also accepting financial donations to support our food programs and emergency needs that our residents are experiencing. If you're interested in making a financial contribution, you can send that check in by mail, or you can put it in the drop box in front of Eno Memorial Hall. A quick update on our businesses. Again, a major thank you to Main Street Partnership and the Chamber and our business resource librarian, Andrew Sherman. They continue to do a phenomenal job assisting and updating our business community. Right now, a key effort that we have been partaking in is looking at guidelines and logistics for temporary outdoor dining for our restaurants. I think a very key piece there was that the Zoning Commission granted staff on Monday night the ability to do administrative staff approvals, which should help expedite and ease the process for our restaurants as they begin to reopen. The state has asked us to look at establishing a long-term recovery committee. Part of that process is identifying key participants and stakeholder groups for the committee. We will be working on that over the next few weeks. Our EDC chair and vice chair, Bob Crowther and Tom Earl, have agreed to serve as our recovery coordinators. And Andrew Sherman, our business resource librarian, will help staff that committee. And so we expect to have more on that in the coming weeks. And then lastly, just a quick reminder, there are a lot of ways for our residents to stay informed during the pandemic. They can subscribe to our emails through news and announcements, regularly check our town website, check out our social media accounts on Facebook and Twitter, and we have been periodically airing public service announcements with SCTV's help. We will be recording a new session later today and hope to have that out tomorrow afternoon. Thank you.
Thank you, Maria. A robust update as always. Appreciate that. Folks, any questions for the town manager?
Hey, Sean, good morning. It's Chris. I got a quick one for Maria, please.
Of course.
Hi, Maria. I'm not sure if at a future public safety or maybe a VOS meeting, getting an update from Tom Taberski. I've heard a couple of residents forward over questions, I've heard questions from some residents around the pool availability this summer. We know that the EOC and the governor's reopening task force have given early guidelines and approval for summer camps to open, private and public. I don't want to assume that every camp has a pool, but I'm sure in there is thoughts of research around how to potentially properly open up our pools. So if and when somebody could possibly give an update on that to get some information out to the public, not that it's a guarantee, but that possibly things are in motion to give us guidance about how to do so in the coming weeks.
Chris, that's actually great timing. And so again, our plans right now are very preliminary, very tentative, based on the best information we have available. But Tom in Orlando and our Parks and Rec team have been working with me on that exact issue, and we are going to present on that on Monday night at the Board of Selectmen meeting, specifically about the potential opening of the pool for the 2020 season. So I think that will be really informative. We'll have information about that in your packet as well. That's going to be released later today. So really looking forward to having that discussion.
Great, thank you.
Yeah, you're welcome.
Excellent foresight, Mr. Peterson. Well done.
Yeah, it was a great question. Good timing.
I'm done for the week.
You've earned your keep, my friend. Good job. All right. Additional questions from Maria. I'll take my opportunity once again to remind folks that just because the building, and I know everybody on the Zoom call, but for the folks at home and on SCTV that are listening, just because the buildings are closed does not mean town staff is not working. There continues to be some misunderstandings through the budgetary process and otherwise that because things are closed, that there's going to be these massive windfalls and savings, et cetera, et cetera. The teachers, the bus drivers, town staff, plow drivers, everybody is still working. There are still plenty for these folks to do. Folks are adapting to the new world. And it's important that everybody stays employed. There's enough unemployment in the economy that it's causing enough stress out there. We do not want these savings in town because they're not actual savings. They'll hurt us in the long run. We want our town staff to stay employed and to continue to provide the services. So forgive the sermon, but I think it's important to remind the taxpayers out there that we need folks to stay employed and continue this, and all of our town staff is ready, willing, and able to serve. So again, just because the buildings are closed does not mean we are closed for business. All right, Mr. Kowalski, emergency management, or Michael?
Yeah, I'll let Michael go first, and he can give you a brief on the EAIP.
Okay. Good morning, everybody. Yesterday, we had a conference call with the governor, and they tried to start explaining the date of the 20th for starting to reopen things. A lot of questions came in from emergency managers about the specifics about it, and unfortunately, they were not able to provide a lot of specifics. So a lot of information about what's going to happen on the 20th with business openings and how they're going to do it and who's going to be able to open will be forthcoming and other calls coming up. WSIM continues to pump out information, so everybody listen to 103.5 for the latest information on businesses, restaurants. The school PTO is putting out spots, doing some appreciation to the teachers. So there we put those on there. And also the police department was nice enough to pass over a spot that we're going to be putting in the rotation. Thank you very much to the chief for that. The small business pod is continuing on Tuesdays. I have been participating with that with the incident management team. The long-term care pod has been going on, continuing Wednesday. Apparently yesterday was supposed to be a huge day with supplies. However, I was not there to see it, so I don't know exactly what happened. Maybe Karen can give some information on what supplies may have been there, what it looked like. And again, we're focusing more on from the emergency side to more of the recovery mode, although we still are experiencing the difficulties with the long-term care facilities, and we are supporting them with whatever needs they have coming up. And Kevin, I'll turn it over to you.
Thanks, Michael. One of the things that to continue with on the long-term care facilities, they have reached out to the Medical Reserve Corps. We do have nurses that have been sworn in at that facility, and they are working. They're certainly looking for more, and we're on standby to swear those folks in as needed as part of the procedure in working in these facilities. So also we continue to manage the PPE cache at the firehouse. We've been receiving PPE in from the state. We had over 800 on the first week and 600 this week that were handed out. Thanks to Sarah this week for taking care of the handouts to the businesses out there, the 600 that will be going out. Like I said, 800 last week. We anticipate probably even more once people catch up with the consideration of opening their businesses. We are taking part in the reopening process thanks to the small group or the small task force that's formed to reopen restaurants. to do it safely. Certainly, we have to protect the folks and get these restaurants open, but we don't want to protect them from the virus and end up with a safety factor of a fire or vehicle problem in the parking lot while we're serving dinner. So we are certainly working actively to get this all proactively done. And so when the restaurants, when they're able to, they'll be able to just take care of the situation and do it. And hopefully that'll help in the long run with them. We'll continue to monitor all the EAPs. We're working with the public assistance program through FEMA for any of our needs and any of the needs that come up here. And I know Amy at the town is doing the same in tracking our costs. Again, it's a cost share. We are looking at the AFG grant process through the federal government, which is a separate stream. That has to be done in 5 days, the application process. So that may be a little bit aggressive, but that's going to be only for rubber gloves, face masks and such that we would need. So that would be going into the future. And we're just constantly on the conference calls, going back and forth with everyone to make sure that all the needs that we can keep are done. That's pretty much it. I'll take any questions anyone has any.
Kevin and Michael, thank you both very much. Any additional questions or any questions at all? Appreciate both your work. Chief Bolter, still with us, sir?
I'm here.
There he is.
Yep. Thank you.
Always good to see your smiling face. The floor is yours.
Okay. I didn't think anybody wanted to look at me for the 15 minutes while we were waiting here.
It's better than looking at me, so it's all good. Keith. Go ahead.
So our staffing is good. Everybody, thankfully, is very healthy. And just to give sort of an update on what we have done since around March 19th, we have about 20% of the staff, and that's not necessarily sworn, but about 20% of our staff have been working remotely as much as they can. Some have still had to return to come into work to do certain tasks, but roughly 20%. So that will be the number that we'll be looking at to see how we can slowly start to have them come back when things are opening up. But as Sean had mentioned, everybody has continued to be working and producing actually quite a bit of work. This has been shown to be a very difficult way to do a lot of our work, but people are hanging in there and doing well. Our call volume is steady. It's increasing slightly with the return of noise complaints, disturbances between neighbors, calls for motor vehicle complaints, driving complaints, and then also some domestic related occurrences. We've seen an increase in the outdoor activity. I think everybody has seen that who has been out, not just on the roads, but on our greenways, our trails, our parks. So we will be putting out what we do normally every year about this time, just reminders on safety for pedestrians and bicyclists. The bears are back, so they're out and about now. We have had some other, very few, but mostly, regionally, we're looking at some potential scams out there involving the stimulus checks. So I'll be addressing that this morning on the SCTV presentation. Just reminding people that the federal government will never call and ask you for information, and in order for you to receive your check, they will not ask for a payment in order for you to receive your check. And there are also some job opportunity scams that are out there. Those sort of easy work from home type scams. So I'll be putting some information out on that. And some of those are along the lines of somebody will think they're being paid to receive some packages at their home, to open them up, to inspect them, and then to reship them out. And what that generally is stuff that's stolen, or stolen credit cards are used for that merchandise. It's shipped to somebody's house. They then print off a new label and then send it off to the person. who has purchased with the stolen credit card. So we haven't seen any of that necessarily, but that is surfacing around. And then we have had some incidents of porch pirates, so people who have stolen packages that have been left at people's homes. So we'll be addressing that as well. And then we'll be working on, or we are working on getting more N95 masks. So we have a really good supply, both here through the ambulance and through what Kevin and his department, or Chief Baldus's department, are storing for the first responders, but we do need some more N95 masks. So we'll be looking for that, and we're currently working to get those. Otherwise, I will take any questions if you have it.
Thank you, Chief. Any questions? All righty. Appreciate you keeping everybody safe. Karen, ambulance.
Yes, good morning. I can say that everybody in our crews have all been healthy. No issues since last week. Everybody's maintaining. All of our crews are here. Our call volume has stayed fairly steady. We have seen a bit of a decrease in COVID calls. Not that we're relaxing at all, but it's nice to see that little bit of a change. So maybe we have peaked at this point, we hope. I did go yesterday to the state to pick up our allotment of PPE and to speak to the activity there. It was very interesting. There was nobody there, which was very odd. There was nobody picking up supplies for facilities, and I was the only person in line for EMS pickup, so I'm not sure where everybody was, which is odd. But there was quite a bit of supply in the garage that it's being stored in, so I'm not sure what that was all about. We did get quite a bit of supplies. We got a lot of Tyvek suits. If anybody needs Tyvek suits, we have tons of them. We got a few N95 masks, a lot of the KN95 masks, a bunch of surgical masks, gloves, and this time we got some sanitizers, which was good to get. But otherwise, we're just plugging along. Nothing else new to report.
Excellent. Glad you were able to get those supplies.
Me too.
All right, folks. Any questions for Karen? All right, Karen, thank you. Chief Baldus.
Hi, good morning, everybody. Similar to the ambulance, we're very pleased to report that everybody's staying healthy. We have no reports of any illnesses. We have no watches in place for any of our members or their families. So things are really in good shape in that regard. We are continuing the distancing measures that we put in place for the past 8 weeks. And then also we are now wearing masks during all of our calls when we're in the fire apparatuses and so forth. Again, just to help protect each other from each other. We continue to use virtual meetings for our training as well as informational sharing on an as-need basis. Weekly, we're back to our Monday night drills, and that's all being done through virtual training programs using our Teams video conferencing, which has been very, very effective. Overall call volume continues to remain pretty low. We do still, however, see the uptick in the increase in open burning, and certainly remind our residents that there is no open burning of any kind of brush material, lawn material, construction material, that type of thing. So we need to be vigilant in that regard and certainly protect ourselves from those types of fires. On another note, as people are getting out and using our trails and up on Talcott Mountain and so forth, a lot more hikers certainly want to remind people when they do venture off into the woods, especially if they're not familiar with where they are or where they're going, make sure you have a well-charged cell phone. If you're with partners, maybe take one cell phone and not use it at all so it remains fully charged. The other one you may be using it for maps and so forth, but always have that available to you. So in the event that you do have an issue, whether it be a loss situation or possibly even a medical situation, you have the ability to call and seek assistance. By having that cell phone, we can certainly track where you possibly may be and helps us to get to you much quicker. So we certainly advise those hikers to keep that in mind. The river remains very, very high, as most of you have seen running through, and very, very cold. So we remind again our recreational users of the river with kayakers and canoes to certainly be very, very careful and vigilant of the conditions out there. Last week, I did mention to you that we did take delivery of a new boat. I'm going to try to do a quick share screen here. For those that do have video, you should be able to see now what our new boat looks like. It's a flat bottom boat that is designed specifically for rescue on river in shallow as well as swift water areas. And so that is there for us to use in the event that we do need it. And that is my report.
Chief, I'm curious as to why you picked Mercury and not Yamaha for that, but we can get into that later.
Okay, sure.
Just giving you our time. It's good to know. And as a former rower, and folks that have known me for any period of time know, the river, as the chief said, is simply not safe to be on right now unless you really know what you're doing or have a very good reason to be there. It is deceiving how fast that water is moving. You turn broadside and you will flip over, especially if you're an inexperienced canoe or kayaker or haven't ridden a rowing shell. So please keep yourself safe and our first responders, because they will come in and get you, but we don't want to have to ask them to come in and get you if that happens. So please stay out of the river. All right. Any questions for Chief? You'll note my fire alarm is right behind me, and I have recently changed my batteries. Can't forget the basics. Neil and Mark, Board of Education.
Yeah, good morning, everyone. I don't think anyone was surprised by the announcement earlier this week that schools will be closed for the remainder of this academic year, which certainly allows us to pivot more of our thinking toward what an eventual reopening would look like. And we've now established what the membership of what we're calling the Return to Simsbury Schools Task Force is going to look like, with folks from our various, not so much the teaching and learning side, but really the operational side. So folks in like our maintenance and head custodial folks, health services, transportation, technology, security, human resources, and then reps from our teachers union and a couple administrators from our various levels, high school, middle school, elementary school. Our first meeting is going to be Monday afternoon. We're going to borrow the format of this meeting with kind of roll call reports. Everybody has their own work to do in each of those areas. But my recommendation to our superintendent was that this meeting has really helped with everybody's off doing their work, but the coordination that happens with this meeting was a model for the way that we're going to try to structure our own thinking. So it's going to be long-term work, but that's kind of where we're pivoting toward. We have earlier decisions to make, borrowing from Maria's report and the mention of Tom Tyberski earlier. Summer camps are allowed to move forward, whether that's a Park and Rec camp that might use our building, our own Department of Continuing Ed summer programming. And Jennifer, if you're still on the call, we would like to be able to have an offline communication with you about any recommendations you have regarding summer camps. Obviously, we saw the guidelines that came out from the state with groups of no bigger than 10 and temperature checks to start the day. And so while we see some summer programming that could happen under those conditions, there's a lot of other summer programming with sports camps and things that's a lot harder to imagine. So if there's a time we could connect off of this call before we make decisions about summer camps, that would be helpful.
Yep, I'm still on. Give me a buzz or shoot me an email. I'm happy to, walk through some of that with you.
Great, thank you. So, Eddie, that's where we're at now, with probably decisions about the Commissioner of Education said further direction about summer school and summer camps would come by the end of this month. So we're really looking by the end of May or the first week of June to be able to make hard decisions about what we can and can't do for the summer. So I think I'll stop there.
Okay. Appreciate that, Neil. Questions for Neil or Mark, anything to add from your side?
Yeah, just real quick, Sean, the Grab and Go program still going forward. We had about 72 families over this past week come in for meals.
Okay. Appreciate that you guys are keeping that up. That's an important piece here. All righty. Moving along. Mr. Roy, Public Works.
Well, good morning. I think to kind of echo, I think what Maria started off with, we had a pretty successful soft opening for the landfill yesterday. We were a little concerned that after being closed for a couple of weeks, we might see big backups and delays, especially with some of the new procedures. Things went, knock on wood, remarkably well. We are continuing with our soft opening today and Friday. During the soft opening, the facility is going to be open to non-pay items, so it's only open for people with existing permits and for the items that don't require any cash transactions. On Saturday, we're going to be opening the facility up for full service, and that will, for Kevin, I know you were concerned, and I think we're finally going to be back into the brush business down there, so we're excited to start some level of normalcy. We've put up significant engineering controls down there with cones and barricades, additional staffing just to make sure that the facility users are practicing good social distancing and being very safe. We are looking and working with our various departments on reopening the town buildings. We've been looking at how to do that safely. We've ordered a number of plexiglass separators. We're also looking at some additional signage and kind of following CDC guidelines. Jennifer Kurtanis, I know you're still on the line. We're open to any help you would be able to provide us in that, just to make sure that both the public and our employees can be as safe as possible. We're continuing to support the various town departments with disinfection supplies and everything else as we get ready to reopen. And we've seen kind of an uptick in construction activity, some of which is being done by the town, some of which is being done by outside utility companies. It is nice that we are taking advantage of somewhat lower traffic, and we've certainly asked and we're requiring all of the crews that are working for the town to practice good social distancing while they're on the job site. But you certainly will see an uptick in activity all across the town in the next couple of weeks. And I can't believe we're talking about it, but we're watching a weather system for this Saturday. They're actually talking a little bit of wind and sleet and, heaven forbid, snow, but just keeping a close eye on that just to make sure if we have any downed trees or anything that we'll be able to respond. So that's what I have.
Yeah, Tom, if you could divert that weather, that'd be great. Because last weekend was a treat, and I got used to the shorts and t-shirts quickly there. So
the nice thing is the going ahead a week, it looks like we're going to jump right into summer with some really hot temperatures. So I'm with you.
Excellent. All right. Any questions for Tom? Tom, thank you for the thoughtfulness there. All right. Maria, you cover social services in yours, right? And Kristen is still out.
I did cover, yes, she is correct. And I did cover social services, but I just had one quick thought. Tom, Roy, would you mind just quickly covering the work on Firetown that's going to be happening?
Firetown is a very busy place. As many of you saw last summer, Aquarian Water, with their contractor Simsbury, installed a new, very large water main. Following up on that work, and it was kind of well coordinated, we are prepping the road for resurfacing this year. So it's going to get new pavement. That was something that was already in our capital plan, so the town ended up really making out well where Aquarian, instead of spending the money on temporary pavement, that money was transferred over the town to go into our permanent pavement. At the same time, we're also replacing the sidewalks. And just to add one more contractor out there, Aquarian is putting some new water mains in some of the side streets, including Simsbury. So again, quite a bit of activity out there. We're looking to be paving the road, so almost all of the work is going to be done May 18th. So by the end of this month, Firetown is going to be looking brand new.
Thank you for that. As someone that travels to that end of town and has family members over there, I will appreciate very much the disappearance of the questions of when is the road going to get paved.
May 18th.
Appreciate that.
This is Kevin, if I may, Sean.
Of course.
Also have old farms that's going to be dug up starting, I guess, this week, correct?
Yes. Yes, like I said, there's a number of water main projects. We still are doing some follow-up work from the gas lines that were installed last year in the south end of town. They still have quite a bit of restoration work. In fact, we met on that yesterday, just setting our expectation that we want the roads back to the condition they were prior to construction sooner rather than later, especially as we're looking at so many people out walking, so many people out biking. Some of the temporary trenches did not, they're showing the fact that they've been there for a winter.
Yep. Appreciate that. And again, for our residents, make sure that you're driving slowly and thoughtfully around our work crews out there. All right. Nancy, VNA.
Good morning.
Good morning.
I don't think I have a big update other than we continue to luckily be safe and healthy. My staff is all safe and healthy. We've had no reason to believe that there's been any disease transmission or spread by going in and out of homes. We're continuing to be able to have capacity to take care of patients. We have enough PPE for now. I'm always concerned because it feels as though we're not on, the list of who would get that sooner than later. But I do know that there are plenty of you that I can reach out to if something changed for me. Otherwise, we're doing really well, and we're looking forward already to planning a number of new ways to do vaccination clinics, because obviously I think the fall is going to be a very different scene this year. But we'll be partnering with Farmington Valley Health District. We'll probably be doing some drive-through clinics. We're already reaching out to all the businesses in the towns. We're partnering with Sarah to do that so that if people want to set that stuff up in advance, they can do so. So otherwise, they're all bright here at the VNA.
Excellent.
Nancy, this is Jennifer. Home health agencies are part of the local health distribution. As you know, we've been trying to prioritize you, but also, as you know, we have gotten no N95s in the last, we got 30 maybe last week, and none this week. But you absolutely are a priority on our list, and to the extent that we have it, we're putting you at the top of the list.
Jennifer, I totally know that you are, and I don't mean my comments to be any kind of complaint, especially at the local level. My concern is always that home health and some of the providers out there that really, I completely recognize what's happening in long-term care facilities. It's just at a state or national level, sometimes I think the recognition for home health and the dangers that we too do, and especially the need to be, considered first, because we go in and out of homes and we don't want to be a part of any transmission. It's just, it boggles my mind sometimes that it feels like we have to constantly kind of shout out to say, hey, don't forget us. It is.
Yeah, I totally agree with you. Yeah. And I think that the prioritization of where certain types of PPE are going is not necessarily being managed as well as it needs to be. But I totally agree with you.
No, I appreciate all of you. I mean, fire, ambulance, you, everybody has, called me separately to say, hey, what do you need? And I think it's great. I mean, the local community has supplied me with more than what the state sort of has. But, it's interesting in terms of being on this end of the spectrum and always feeling as though you have to say, hey, don't forget us. But it's all working out, and we really are well equipped at the moment. And, we are getting patients from Yukon because we have the capacity to take care of them. So it's all going well. We're not seeing any kind of regression or any kind of backward slide with family members or other people that we're taking care of. So, you know, I'm happy to say that things are, I think, in control at the moment.
Excellent. And once again, a shining example of why local government, especially this local government, makes a lot of sense. You guys are all very thoughtful and take good care of each other and think about your agencies and each other's agencies. So, Nancy, as you said, you got a lot of friends here, and I'm sure if the need arises, you'll be well taken care of.
I really will remember that. I've never not lost value of how great it is to be a part of this community. I mean, it's just it's not what my colleagues in other parts of the state experience, and I'm very grateful.
Oh, thank you for sharing that. We are very proud of it, but this is, as you know, this is what we do here. All right, Sarah, share with us how our business friends are doing.
So this has been mentioned, but I think it's worth mentioning again. I want to give a huge thanks to the Farmington Valley Health District, to Jennifer Curtanis and her team, and especially Jason Brown. Main Street has been very closely working with them on the reopening first of the outdoor dining establishments, but then also on the salons and other things as we move closer to May 20th. I just want to mention, as Kevin mentioned, we are in charge this week of distributing the Concept CBIA masks to our essential business owners. Just a reminder to get your order in because they will be stopping. It's going to be supplies as they have them. We did an updated list of our restaurants yesterday. It's worth noting that both Peach Wave, Main Moon, and Starbucks have all reopened as of yesterday. So we updated that list. I know it's making some people very happy. That list could be found again on shopsimsbury.com, and it's also on our Simsbury, Connecticut Facebook page. A reminder for your Starbucks lovers, it's mobile app only. So you cannot go up to the window. You can't go there and order. You have to order via mobile app, and they bring it out onto a table. We have Mother's Day coming up, and much like Cinco de Mayo, please, to the public, budget a little extra time, budget some extra patience, be patient with these restaurants. They're getting flooded. They're trying to keep as safe as possible. So just, again, please be patient, be kind to each other, and especially to our restaurant owners during this week, in this weekend. Again, we're working on the FAQs to reopen for all the various businesses. And I think that we had a great phone call yesterday. I just want to remind the public as well. I know the town is getting some phone calls. I know that the health district is getting phone calls, the fire district, and ourselves. Everybody has a different level of comfort. And so please remember that while the state is making plans to reopen, that if you still feel that you're high risk and that you're uncomfortable, you can still, the restaurants are all offering curbside pickup or delivery. My grocery stores are, that you can still exercise the utmost caution. And again, please just be patient. We're getting flooded with phone calls and flooded with a lot of different complaints and things. And our business community and all of the people on this call are trying to do the best possible to keep the public safe, but also to move forward with the reopening as the governor has outlined. So just, again, please remember that your level of comfort can be very different than someone else's. We're really working, as you can tell by these calls every Thursday, on very critical issues. And so sometimes it's not as helpful as we're dealing with some of those things. And that's what I have for now. And because I know we have some selectmen on the line, just a reminder, Main Street has, and Maria, thank you, we have asked for the Board of Selectmen to waive the fees for the outdoor dining. We put in a specific request, and I understand it'll be on your Monday meeting.
It is, and it will likely have unanimous support. So, it makes sense. And again, Sarah, thank you. Maria, thank you for everybody to put that together. Another example of just, a great idea quickly coming together to get on the agenda. So we all do our part. And again, I'll make one additional plea, as it seems to have picked up again. Please get off Facebook and stop complaining about your friends and neighbors and businesses. Yeah, it is just not. I know people are frustrated. I know these are challenging times, but ripping your neighbors, ripping your friends, ripping these businesses on Facebook for a little bit of weight, as Sarah articulated very nicely, is just not productive. Folks are trying to do the best they can right now. And if we all exercise a couple of more seconds of patience, a quick 1, 2, 3, we're going to get our orders, we're going to get our needs, and we're all going to stay safe. And that's what matters. And I know it's frustrating. Trust me, I've got a little one at home, and when it's dinner time, it's dinner time. I get it. But remember, these folks have little ones at home too, and family members. So appreciate those that are exercising patience as well as thoughtfulness out there. Mark, I apologize for making you wait all the way to the end. But
quite all right.
How are our friends at Eversource?
We're doing very well, thank you. I just wanted to make a note that we participated in a few video calls with the state this week with PURA, Public Utility Regulatory Authority, and all of the regulated utilities participated in those. Talked about different opportunities for both our business and residential customers if they're having needs in terms of paying of their bills, their financial terms. You're going to see programs that are, I would say, are going to be short-lived in terms of duration in dollars, let's say, and how they're going to spread them out over a much longer period of time. These are programs that are unheard of in the industry. And I don't see that they're going to be around for very long once we're out of the woods with the current situation here. So I would strongly encourage any business or residential customer to visit our website, our sister company Aquarion's website. There are different programs on the water side as well. And then also I'll forward out some links to the actual meetings. They're a bit long, but you can, now that they're recorded, you can skip through to the appropriate utility companies. I know that we don't have gas in Simsbury, but C&G was part of that meeting as well. So there might be some good information for C&G customers in Simsbury. And I'll be happy to forward that along to this group later today.
Thank you, Mark. Appreciate that. Questions for Mark? All right.
Not a question, but thank you. We got out your information after the last meeting to all of the business owners. So we appreciate it, Mark.
Oh, great. Thank you. You're welcome.
Excellent. I did receive a very thoughtful and timely email from Gary this week reminding me that we did have an ordinance that we were diligently working on as far as wildlife. That has not been forgotten. Gary, thank you again for resurfacing that. My intent is still to bring that to this group and the Board of Selectmen. Just wanted to respect, obviously, that you all have 9,000 other things going on right now. And while a bear ordinance or a feeding ordinance is important, certainly not at the top of anybody's list right at the moment. But again, it is a public safety issue. So Gary, thank you for the reminder. We will be getting that back on the agenda in pretty short order here.
Okay, sounds good. Thanks, Sean.
In the meantime, folks, don't use regular birdseed or suet, please. It's pretty much common sense. Are there other questions, updates, things folks would like to get off their chest? Please don't put them on Facebook. Bring them here. All right, everybody. I appreciate you very much. I know the residents do. Thank you once again for joining us on this weekly call. Again, I received nothing but outstanding feedback on your updates, on your professionalism, on how thoughtful you all and your departments are all handling this, that residents are able to worry about things like how long takeout takes, which is a good thing because that means they know they're safe and they know that the important stuff is taken care of. So please remind everybody that works on your team and with your teams how much we appreciate them, and thank you all very much. Stay safe, and this meeting is adjourned.